vulnerable population when we talk about domestic violence and mental health impact. I will look at people with mental health conditions, people with psychosocial, cognitive, and intellectual disability. The reason why I see this population as vulnerable, because it's a population which is at more risk for various reasons I'm going to explain, and also requires more protection, support, and care to reduce their vulnerability and the impact which come because of violence. Yeah, so this group of persons with mental health conditions, psychosocial and intellectual and cognitive disability, they are at more risk because of a number of reasons. First is the state of their health do predispose them to be at risk because when they are unaware, they may not be in positions of advantage, issues of power dynamics, and this may result in people taking advantage of them. Secondly, the stigma and discrimination associated with issues of mental illness. People do form stereotypes. They have issues of attitudes toward them, and this results into a lot of violations of their rights, which may result into violence. They are denied health care, they are denied food, they are denied employment, they are denied their rights and freedoms, especially in a domestic environment. And all these exposes them to physical, psychological, economic, and even sexual violence. Again, also, people with mental health conditions not only being at high risk of violence, they may also have gotten into these problems because of other violence which has happened in their life. They may have gone through violence in early childhood, a lot of traumas which also may expose them to mental health conditions. So it's a very vicious cycle. So violence exposes them into mental health conditions, and then when they're in this situation of mental health condition and psychosocial disability, they are more prone to violence from the people they are living with, their partners, people within their home environment, or even within the community. And so these exacerbate their mental health conditions and result into more violence in their life. And generally, there's a stigma that people with mental illness may be of any threat, which evidence proves contrary. People with mental health conditions are not violent. They are actually at more risk of being violated by other people in the general population. And also, other situations when people have mental health conditions, they may, or even some other personality conditions, they may have issues of substance use, alcohol and other substance use. These may make them prone to be victims of violence, but then they can also make them to be perpetrators of violence, especially when they are using things like alcohol. But generally, people with mental health conditions are not violent, but association sometimes with use of substance may also make them perpetrators of violence. And what I'm saying, this may become a vicious cycle. These adverse childhood experiences which are to do with violence and make people prone to mental health conditions may make them get into what we call intergenerational cycle of violence. That there were victims and survivors of violence, they may become perpetrators of violence, and this may become a continuous process. Yeah, so as I mentioned, the issue of violence is a major public mental health crisis. And the reason why I say so is because there is a lot of association between violence and a lot of mental health related harms. Looking at the whole spectrum of mental health being, not only even those people with may have serious mental health condition, even mental health distress and a lot of mental health problems. Let me try to explain this association. What has been shown by evidence is that exposure of people at a young age to various forms of domestic violence make them at more risk of developing mental health conditions in life. Again, regardless of age, even in adults, exposure to any form of violence increases risk to developing issues like anxiety, depression, substance use, post-traumatic stress disorder. And this has been shown through a lot of research that the prevalence of this mental health condition is by far more within this population with mental health conditions, especially if they're exposed to violence. The second element is the issue of stigma, especially to this population. What happens is you have a mental health condition and you are living in a family, in a community. You are at more risk to be a victim of violence. And then this increases or exacerbates the mental health condition you are living with. The other impact is them not accessing care and support, because with this kind of violence, people stigmatize them, discriminate them, and some of the violence perpetrated towards these people is they are denied their rights, including denial of rights to treatment, to health, denial of their reproductive health rights. You know, some of them are forced into marriage, others are forced to procure abortion, they are denied planning in terms of their reproductive health, family planning, and many other rights which are denied. And then this become a cycle of violence, a cycle of exacerbation of the mental health complications, and which may lead into things like severe mental illness, suicide, issues like psychosocial disability, and even death, because most of them will be victim of homicide and also may be victim of suicide, which may cause death. With this kind of understanding of seeing the association between violence and mental health related harms, we really need to look at a whole holistic way of addressing these issues in terms of understanding the underlying mechanisms and the drivers of violence, and especially to this vulnerable population. And we try to look at this strategy from individual, the family, and the relationship within the families, community, and the society in general. So I try to see like a whole society approach. And when you look at the drivers, especially when you're talking about prevention, we really need to see of what are the individual risks, especially with people with mental health conditions. And the aspect of having untreated mental health condition increases their risk of violence. So the first important thing is to ensure that they get the necessary care and support, that the mental health challenges they are going through are addressed, they get the good care, and we get them back them into good health, because that's reduces their risk of being victim of violence. The second aspect is looking at when they are living within their families, is identifying that there are risk or there are telltale signs that they may be at risk of violence. So we must be able, through our community mental health system, be able to identify those people who are at more risk by doing a screening within the community when we are interacting within our community mental health program, to be able to identify there's a person with a mental health problem, they are at risk of violence, or there's someone who is at risk of violence and is now at risk of developing mental health problem. We are able to identify them very early, get them into intervention, and this intervention not only focus on the individual, it will focus on the individual, the family, the people who may be perpetrating violence, because some of these violence, especially at a domestic level, the drivers have some socio-cultural perspective, and people within their marriage or within the family, they may not think what they are doing is some form of violence towards the person. So these are the screening to identify people who have mental health problems due to violence, or people with mental health problems who are at risk of violence, and getting them into care. The third line of this approach is ensuring that our services are more friendly or are more accessible to people who are at risk of violence. And the way to make these services more available and accessible is ensuring that first, the healthcare workers are trained to identify these problems and those are at risk. And then are they able to provide care to survivors of violence in a way which they are able to provide information to them, they are able to support them and get to recovery. So we normally say that we need to reform our services to be more trauma-based approaches and also to have more friendly to the survivors. So that's something we need to work with our healthcare workers, starting with the community health volunteers. The second aspect is about strengthening systems which protect and support people who are survivors of violence and also to prevent violence. And this is about enforcing the laws. This is one way of preventing. We may ensure that there are laws and policies which addresses issues of domestic violence and especially to vulnerable population. Ensure we are enforcing these laws and also educating the people, because we can have the laws but people don't understand. Some have to do with a lot of socio-cultural issues, like I mentioned, issues like sexual violence have a lot of socio-cultural perspective, issue about like female genital mutilation, forced marriages, and the violence which result from that. And then that with the laws and the policies, they will improve the systems. The other element is why do we have this vulnerability in these individuals and who become at high risk of violence? There are a lot of social determinants and inequalities which are drivers of these kind of vulnerabilities. Some of these social determinants are issues like poverty. People are poor, and so they have issues of power dynamics which make them very vulnerable. People are unemployed. They don't have a source of income. So they could be the perpetrator of the violence. They are dependent on them for their livelihood. So we need to empower people on issues of poverty reduction, making people have employment, education, because people need to have, when we improve on education, it will address issues of ignorance, attitudes, and issues of stigmas, which are associated with mental health conditions and increases them being vulnerable to violence. So issues like education are very important. So by addressing these inequalities and social determinants, we broadly will be able to reduce the risk and reduce the violence and the vicious cycles which result into more health harms. So that's very key important. That's something can be approached at a society level about reducing inequality, including even socio-cultural beliefs. In some communities, they believe in about forced marriages, female genital mutilations, thinking that people with mental health conditions are bewitched or they are accursed, and then they are seen even they could be a more threat to the community. So when we educate the people and address these issues of inequalities and beliefs, then that would be very important. And then more is to increase on surveillance, issues about research to understand more about this association between violence and mental health related harms, and people with mental health conditions being at more risk of violence, and see the best strategies and programs we can put in place to be able to reduce this. So I think that's the broad perspective from individual level to the society level on how we can address issues of violence and curb the cycle of violence to decrease the prevalence of mental health problem, and also making they reduce the increased vulnerability of people with mental health condition being more vulnerable to violence.